Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, duodenal ulcers. Right. In the duodenal ulcer, first etiology of duodenal ulcer. Right. Duodenal ulcer can occur due to many causes. Duodenal ulcer can occur due to the following causes. It can occur due to the stresses. Stress, some types of stress can result in duodenal ulcer, like stress and anxiety, where the patient has hurry, worry, and curry type. These patients we have duodenal ulcer is common. 90% of duodenal ulcers are caused by H. pylori infections. Duodenal ulcers also occurs whenever there is association with NSAIDs or non-steroidal anti-inflammatory drugs or steroids can cause duodenal ulcer. Blood groups like O positive individuals have increased risk of duodenal ulcers. Endocrine causes includes whenever the patient has Zollinger-Ellison syndrome or multiple endocrine neoplasia type 1, Cushing syndrome, hyperparathyroidism, or if the patient has takes alcohol, or if he smokes, or if the patient has vitamin deficiencies, or if the patient has chronic pancreatitis and cirrhosis, all these are the risk factors for duodenal ulcer. Then, what is the most common site of the duodenal ulcer? The most common site of the duodenal ulcer is the first part of the duodenum. And this first part of the duodenum is also the most common cause of peptic ulcers. Overall, is the first part of duodenum. So, if this is the duodenum, in the first part of duodenum, you will see that the duodenal ulcers are common.
thank you and thank you for watching.